Hi, good afternoon, everyone. So as David mentioned, this is Dr. Jana Kim. I'm just going to do a few brief slides. Some of this might seem familiar to you, but we really want to just review some of the basic clinical things that we know about coronavirus 19. The other quick disclaimer is that this is based on what we know as of today, and we all know that information keeps changing as we come to know more about the virus. So my brief section is just going to be talking briefly about the signs and symptoms of the coronavirus 19, otherwise known as COVID-19. Some of the clinical progression that we've been seeing in the outpatient side. Oftentimes when you're in the hospital, you're seeing people when they're the sickest. But I did want to review what we've been seeing from the clinical presentation side that oftentimes that we are working on trying to alleviate and address and hoping to avoid people from ending up in the emergency rooms and ICU. A couple things about how it spreads, as well as how to protect yourself, i.e. how to make sure you're putting on your PPE right. So just a bit of review, and this is based on the latest information provided on the CDC website. There are some common symptoms as well as less common symptoms, but all of these are very suggestive of coronavirus. I've come to call this the great mimicker, because a lot of these symptoms can look like other things such as flu or even the beginnings of seasonal allergies or even something as simple as strep throat or pharyngitis. So it's important thinking about your differential of making sure that you don't miss something that could be for COVID, even though we think of the more common things. But the most common and the things that are the most sensitive to have us to think about whether someone presenting could be coming in with coronavirus is fever and cough with or without any productive sputum. And oftentimes the cough usually does start off without it producing any phlegm or congestion. Usually it starts off as just a dry cough. And over time that does develop into some productive sputum later on. They can also start off first presenting with fatigue, anorexia, feeling body aches all over, just feeling just yucky and feeling blah is another way patients might have described it. And sometimes they'll start having a little bit of shortness of breath, but that usually doesn't happen until a few days into the illness. And then they'll also have some sore throat, nasal congestion, and headache is a common presentation, and that headache tends to linger even for days after the worst part of the infection. A less common presentation that we are seeing is more in the GI route, where patients will start with a day or two of diarrhea, maybe a little bit of nausea, vomiting, but that doesn't last for very long. And the one symptom that we were starting to hear a lot about in the last week or so was the loss of smell and loss of taste. The information coming out of Europe was of a mom who was unable to smell her baby's dirty diaper, and she had tested positive for coronavirus 19. Also remember that individuals who are older or immunosuppressed may present a little atypically, which is why this needs to be high up in our differential, especially during this time of year. So usually the way that the clinical progression goes is that usually in the beginning, patients will usually have a low-grade fever, maybe up to 101, but you never really see those high fevers that we see in typical viral infections. And usually the fever will tend to go away or go back to like a low grade by about day 5. And patients sometimes think, oh, that was no big deal, that's okay. That fever ends up coming back later on in the progression of the illness. But during these first few days, those other upper airway symptoms also start up then. The sore throat, maybe a little bit of a cough, maybe a little bit of a headache, but it's very nonspecific. Oftentimes during those first 5 days, that's when you'll see the GI symptoms. And usually they are pretty self-limited and usually go away after that first few days. It's generally the second set of 5 days, so between day 5 to day 10 is when things start to really get severe. The cough will start to get worse. You'll start to see more of a productive cough. Then you'll also see some more of that shortness of breath setting in. It's by around day 10 is when you start to see the real severe pneumonias and the shortness of breath, and that's when people are coming to the ER. So if you are also doing anything in the outpatient side, just keep in mind of this progression. And our hope is that we can try to catch some of those people before they get to the ER. Just a reminder about how it spreads. There's been a lot of discussion on whether this could be droplet versus an airborne process. At this time, it's still being considered a droplet cause of a process. So that's why at minimum you have to have contact precautions for that. The thinking is that the airborne portion is that when the virus is in the droplets may linger in the air for up to 3 hours. And so that's the reason why if you're in a patient room for more than 10 minutes, that's when the respiratory precautions are going to be necessary. But to the best of our knowledge, it is not spread by an airborne process like something like TB. So the most important thing, and what we're finding is when healthcare workers are getting sick, is that we all need to make sure that we're using our PPE the right way. And the most common way that we can get contaminated is when we're not putting it on the right way and we're not taking it off the right way. So just a brief review of the PPE that are required is that you'll see here from this picture is that you'll see they have the gown, there's gloves on, it can be non-sterile, you have the face shield or goggles, and then having the N95 respirator on. And a lot of places are now putting on the face masks of, the surgical face masks on top of the N95 respirators, so to preserve the N95 length for reuse. If you're not going to be in a place where you're getting the respiratory droplet exposed for a long period of time, you can use a procedure face mask, as this other picture is showing you, as long as you have that face shield in front. But I believe at the hospitals, most people are trying to get those N95s on. But the most important thing that I wanted to talk about is making sure that we're putting it on and off the right way. And it sounds a little simple, but this is where it's the most common way to get contaminated. And so I briefly pulled this from the CDC again. Again, a couple points just wanted to mention is that when you're putting on your PPE, make sure you've gotten everything all in front of you, because you don't want to start putting things on and said, oops, I forgot my face shield. So make sure you have everything in front of you when you're starting to put it on. Another common area that we forget is making sure when you put your gloves on over your gowns that the gloves must cover the cuff of the gown so that you have no skin exposed. And so making sure you go through a step-by-step, and this is where when we get into conversations, sometimes we forget, you really need to make sure that this becomes almost second nature. Otherwise, it's best probably not to get distracted. The other part that's the area that we can get ourselves into getting exposed, we've done such a great job in putting on the PPE. We've done such a great job in maintaining our care to the patients. Then it's a matter of how do we take the PPE off without us contaminating ourselves. So this is where it's really important that when you take the gown off, make sure when you take your gloves off, you take them, they call it the glove in glove technique, where you're putting the gloves inside one another and that you're turning them inside out, because now those gloves have been contaminated on the outside. Making sure you take your gown off. Now here they talk about taking everything off when you're within the room, obviously not right next to the patient. But make sure that when you're taking it off that you keep the outside of that gown away from you, turning it inside out. And then making sure that you're washing your hands before you then start to touch the face shield and your masks, because it's really easy to easily cross-contaminate ourselves when we're doing that. And again, this is where it's super important to know where your hands have been and where you're touching things, and getting yourself into a safe space so that you know that you've kept yourself as decontaminated as much as possible. And then after you've done all of that, making sure that you're washing your hands again. I think this is one area that's super important, that we need to make sure that we're watching out for one another and just decreasing the chances of us getting contamination with one another. So again, other suggestions, washing your hands. We talk about using hand sanitizer, which it is acceptable, but soap and water is actually the gold standard. So making sure that every other time you're washing your hands, you can use your hand sanitizer if you can't get to one, but taking that 20 seconds to wash your hands with soap and water is the best thing. Following your basic PPE management, making sure, again, when you're taking it off, making sure that you're minimizing any chances of contamination is the best way of watching out for yourself. Wearing scrubs, wearing clothes that are easy to wash, wearing footwear that's easy to take care of, and then when you come home, changing clothes as soon as you get home, taking a shower. Those are all the things that we can do to keep ourselves from also getting our family members at risk. And again, washing your hands is the last thing. So we wanted to mention that we are here to help. And another tip that I wanted to share is Psalm 91 has been a book of the Psalms that's come very valuable to our staff, and just talking about the power of knowing that we are in His shadow and we are under that protection, even in the midst of everything that we see in the floors, as well as when we see patients. So I wanted to give that encouragement to you all, but also feel free to reach out if you have any questions.
Okay. Thank you very much, Dr. Janet. Again, hopefully people are processing through what Janet's gone through. It's a very brutally practical guide, and again, we're going to try to get this presentation available to everyone so that you can go through the slides at your leisure. But I think the key thing is, again, to stop and think before you act. So, stay calm and don't be too high, don't be too low. Stay focused on your task at hand. So, Christine, are there any questions at this time for the short Q&A that we're having after this?